There is a moment that changes everything, not the moment you get the diagnosis, the moment you realize the diagnosis was being written, quietly, over years, inside your own kitchen, by your own hands, using habits you were never once warned about. I have watched that realization cross the faces of patients sitting across from me more times than I care to count, and every single time they ask me the same question: why did no one tell me this sooner? Today, I am telling you. My name is Dr. James Harlow, and I have spent over 2 decades working in gastroenterology and oncology research. What I'm about to share with you involves 5 specific foods that tens of millions of people reheat every single week in their own homes, completely unaware of the chemical changes happening inside those foods the second time heat is applied. These are not obscure foods. They are foods you almost certainly ate this week, and the connection between reheating them and one of the most lethal cancers in modern medicine is something the research community has understood for years, while the general public remains almost entirely uninformed. I want to be very clear before we go any further. I am not here to frighten you. Fear without direction is useless. What I'm here to do is give you the specific, actionable understanding that allows you to make genuinely different choices starting tonight. Because the difference between what damages the pancreas and what protects it often comes down to something as small as which appliance you use, how quickly you cool a pot of food, or whether you eat something warm versus cold. Stay with me through all 5 of these, because by the end of this, you are going to understand your own kitchen in a way you simply did not before. But first, let me tell you something about the pancreas that almost nobody outside of medicine fully grasps. The pancreas is not like your heart or your lungs. It does not announce its distress. It has almost no pain receptors in the traditional sense. It sits quietly behind your stomach, performing 2 of the most critical functions in your entire body, producing digestive enzymes and regulating blood sugar through insulin. And it does all of this in complete silence. When something goes wrong with the pancreas, it does not send you signals early enough to act on them. By the time symptoms appear with pancreatic cancer, the disease has in the vast majority of cases already progressed beyond the reach of curative treatment. The 5-year survival rate sits below 12%. That number has not moved meaningfully in decades. That is why everything I am about to tell you exists not as an interesting fact, but as something with genuine life or death implications. Let us begin. The first food is the one that I want you to think hardest about before we discuss it, because I suspect you already sense that something is wrong with it, even if you have never been able to name exactly what. Picture any fried food sitting in your refrigerator right now. French fries from 2 nights ago, leftover fried chicken wrapped in foil, a spring roll, a battered piece of fish, anything that was originally cooked by submerging it in hot oil. Tomorrow, you will probably either microwave it or, and this is actually worse, heat a fresh pan of oil and refry it to get the texture back. That second contact with heat is where everything changes. Here is the chemistry you were never taught. The cooking oils that most people use every day: sunflower oil, corn oil, vegetable oil, soybean oil. These are polyunsaturated fats. They are structurally unstable under high heat to begin with. But when you heat them a first time, cook your food, let that oil cool, and then expose it to high heat again, you trigger what is called deep oxidative degradation. This is not a minor chemical shift. This is a transformation that produces a family of toxic byproducts called aldehydes, specifically compounds such as 4-hydroxynonenal and melandialdehyde, both of which have been studied extensively in the context of cellular DNA damage and carcinogenesis. What these compounds do inside your body is generate a cascade of free radicals. Think of free radicals as chemically unstable molecules that stabilize themselves by stealing electrons from your healthy cells. Each time this happens, that cell sustains damage. Most of the time, your body's repair systems catch it. But this is not a one-time event for most people. This is a repeated weekly exposure. And cumulative DNA damage to cells, including those in the pancreatic tissue, is one of the foundational mechanisms through which cancer develops. There is a second layer to this. The inflammatory response your body launches to contain the damage from these oxidative compounds is metabolically expensive and, when it becomes chronic, directly harmful to the organs embedded in the inflammatory environment. Your pancreas, surrounded by adipose tissue and intimately involved in managing systemic blood chemistry, is acutely vulnerable to that chronic inflammatory state. A pancreas operating inside a persistent low-grade inflammatory environment is a pancreas under conditions that favor abnormal cellular behavior over time. The fix here is straightforward. Never reheat fried food using oil of any kind. Not fresh oil, not the residual oil on the food itself as a frying medium. Use a dry oven set to around 180 degrees Celsius or an air fryer. You restore the texture. You generate no additional aldehyde compounds, and please treat cooking oil as single use. Oil that has been used to fry food and then stored for reuse has already undergone partial oxidative degradation. Every subsequent use increases the concentration of harmful compounds in your food. If this first one surprised you, the second one is going to challenge something you have probably been told is unambiguously good for you. Think about leafy greens. Spinach, kale, Swiss chard, arugula, collard greens, everything the nutrition world has told you to eat more of. You cook a large batch on Sunday, feel genuinely virtuous about it, and then refrigerate the rest to reheat through the week. This is common, this is practical, and this is where a specific and well-documented chemical pathway begins operating inside your food without any visible or sensory warning. All leafy green vegetables contain naturally occurring nitrates. In their fresh state, and even when first cooked, these nitrates are biologically harmless. They do not pose a meaningful risk in a single fresh meal. However, the moment cooked leafy greens begin to cool, bacteria that are naturally present in the food, and no amount of washing or careful handling eliminates this entirely, begin converting those nitrates into nitrites. This is a well-documented microbiological process that occurs at the temperatures typical of food that is cooling on a counter or even sitting in a refrigerator. When you then apply heat a second time to that stored cooked spinach or kale, those nitrites react with amino acids present in the food in a reaction that produces nitrosamines. The International Agency for Research on Cancer has classified several nitrosamines as probable human carcinogens. They are genotoxic, meaning they act directly on the DNA inside your cells, not by creating external inflammation, but by entering the nucleus itself and interfering with the genetic instructions that govern how your cells replicate. Over time, with repeated exposure, that interference accumulates. Your body's DNA repair mechanisms are remarkable but not infallible. When the accumulated corruptions exceed what those repair systems can correct, you begin moving toward the conditions that precede malignant transformation. The pancreatic connection here is specifically tied to the route these compounds take after absorption. Nitrosamines enter the bloodstream rapidly through the gastrointestinal lining. They circulate to every well-perfused organ in the body, and the pancreas, given its rich blood supply and its role in processing and detoxifying substances absorbed from the gut, receives repeated exposure with every reheated portion of leafy greens you eat. The fix is simple enough to implement today. Eat cooked leafy greens cold, a cold spinach salad with olive oil and lemon, kale folded into a grain bowl that is already room temperature, chard mixed cold into a wrap. Every nutritional benefit remains completely intact. The nitrosamine pathway requires that second application of heat. Without it, the reaction does not reach meaningful levels. If cold is not palatable to you for a particular meal, then cook only the portion you are eating right now. Batch cooking leafy greens for the week, and reheating each portion is the precise pattern that drives this risk. And if you must reheat once only. Each additional heating cycle compounds the conversion exponentially. Now pause here for a moment and ask yourself honestly how many times this week you reheated leafy greens. Write that number in the comments below. You do not have to share it publicly, but knowing it matters because it is the gap between what we do habitually and what we do consciously that creates most of the preventable health damage in our lives. The third food on this list is the one that I genuinely believe will be the most unexpected because it looks completely harmless. It smells harmless. It tastes exactly the same way it always has, and the danger inside it is entirely invisible to every one of your senses. Rice, plain cooked white or brown rice, the most commonly eaten food on the planet, cooked in large batches and reheated in portions across multiple days by hundreds of millions of households on every continent. This practice is so universal that the idea of it being dangerous feels almost absurd, but the danger is not in the rice itself. It is in a bacterium called Bacillus cereus, and understanding what it actually does explains why it matters specifically to your long-term health, not just your short-term comfort. Bacillus cereus is present in raw rice from essentially every commercial source in the world. This is not a contamination issue or a quality problem. It is simply the reality of how this grain grows and is stored. When you cook rice, the boiling water kills the active bacteria, but Bacillus cereus has a survival mechanism that cooking does not overcome. It produces spores. Spores are biological structures of extraordinary resilience, hardened casings that allow the organism to survive conditions that would destroy most living things, including the heat of normal cooking. Those spores remain dormant inside your cooked rice, completely undetectable, waiting for the temperature to drop into their ideal multiplication range. That range is the temperature of your kitchen counter as rice cools after cooking. As the temperature falls, those spores activate, the bacteria multiply, and they produce toxins as a byproduct of their metabolic activity. One of those toxins is heat stable. When you microwave that rice the following day, you eliminate the living bacteria, but the toxin they already produced while multiplying during cooling survives reheating entirely intact and enters your body in full biological activity. Now here is the piece that most discussions of reheated rice miss entirely, because most coverage of this topic focuses only on acute food poisoning. And yes, high levels of Bacillus cereus toxin can cause vomiting and diarrhea. But the more relevant long-term concern is what happens at low-level repeated exposure, chronic low-grade gut inflammation caused by repeated small doses of bacterial toxins below the threshold of full symptomatic illness but above the threshold of biological neutrality maintains a persistent inflammatory state in the gastrointestinal environment. And through what researchers now refer to as the gut-pancreas axis, a well-characterized network of shared blood supply, lymphatic drainage, and inflammatory signaling pathways connecting the intestinal environment to the pancreas, that gut inflammation does not stay contained to the gut. It reaches the pancreas repeatedly, over years. How many days has the rice currently in your refrigerator been sitting there? If the answer is more than one, that is a habit worth changing today. The fix involves 4 specific practices. Cool cooked rice within 1 hour of finishing cooking, spreading it in a shallow, wide container rather than a deep pile to maximize surface area and accelerate cooling. Store it in the refrigerator immediately. Consume it within 24 hours. When reheating, bring it fully to steaming hot throughout the entire portion. And once you have reheated it, finish the entire portion. Do not put reheated rice back in the refrigerator for another round. These are not complicated rules. They are just rules that most people never received. The 4th food involves not just what the food is, but what a specific appliance does to it in a way that most people have never been told about. And the gap between what feels safe and what actually is safe here is quite significant. Think about reheated chicken. Roasted thighs, baked breast, rotisserie chicken you saved from yesterday. You place it in the microwave for 2 minutes. The outside feels hot to the touch, so you eat it. This is a completely normal experience in millions of homes, and the problem is entirely invisible, which is exactly what makes it worth understanding. Microwave ovens do not heat food the way a conventional oven does. An oven heats the air around the food, which then transfers heat evenly and progressively from the outside inward. A microwave excites water molecules within the food itself, generating heat from within. But here is the critical issue. Different parts of the same piece of chicken have different water content, different fat-to-muscle ratios, different densities. The microwave excites water molecules at different rates in different regions of the same piece of food. The result is what food scientists call cold spots, internal areas of the food that remain at significantly lower temperatures than the surface or outer portions. These cold spots are invisible. They produce no external signal. The outside of that chicken thigh can be genuinely hot, while a region just centimeters inside remains at temperatures that are not merely insufficient to kill bacteria, but are actually ideal for bacterial proliferation. Salmonella and Campylobacter are the two primary pathogens of concern in poultry, and both are present in raw chicken at rates that make proper cooking non-negotiable. Thorough initial cooking eliminates them, but post-cooking recontamination from surfaces, utensils, or hands is not uncommon, and those cold spots in microwave reheated chicken are warm, moist, protein-rich environments where surviving or reintroduced bacteria do not die. They multiply. The acute illness scenario is well known: high fever, severe gastrointestinal distress, systemic immune mobilization. But again, the long-term concern that is less discussed is repeated low-dose exposure. Immune system activation events that are too small to produce dramatic symptoms, but large enough to sustain chronic gut inflammation, occurring regularly over years, feeding inflammatory signals through that same gut-pancreas axis we discussed with rice. The pancreas does not escape the consequences of what happens chronically in the gastrointestinal environment around it. The fix: use the oven, 175 degrees Celsius, covered tightly with foil, 15 to 20 minutes. The moist, trapped heat distributes evenly, reaches every region of the food uniformly, eliminates cold spots entirely. If you are committed to using a microwave, then cut the chicken into small uniform pieces. Use medium rather than maximum power. Pause halfway through to redistribute the pieces, and let the covered dish rest for 2 full minutes after the microwave stops before eating. Resting allows heat to equalize from hotter outer regions into formerly cooler interior ones. Or, and this option eliminates every risk we just discussed, eat the chicken cold. Shredded cold chicken in a salad or wrap requires no reheating, no management of cold spots, and no inflammatory cascade reaching the pancreas. Subscribe to this channel if you want to keep receiving information like this. The things your doctor never had time to tell you in a 15-minute appointment are exactly what we cover here. Hit that subscribe button now and make sure you never miss a video that might matter as much as this one does. Now we have arrived at the fifth and final food, and I want to give it the attention it deserves because it is unique on this list in carrying not one, but two simultaneous chemical dangers operating through completely different biological pathways, both converging on the same vulnerable organ. Potatoes, roasted, baked, or fried, cooked in a large batch, refrigerated, and then reheated the next day, often at high heat in a pan with oil to restore that original crispiness. This is resourceful cooking. It feels practical and sensible. And inside those reheated potatoes, two distinct chemical events are unfolding at the same time, each one harmful to the pancreas through a different mechanism. The first is acrylamide. When starchy foods are exposed to temperatures above approximately 120 degrees Celsius, a chemical reaction between naturally occurring sugars and an amino acid called asparagine produces acrylamide as a byproduct. That deep golden color you see on perfectly roasted potatoes is the visible surface signature of this reaction, known as the Maillard reaction. Acrylamide forms as part of the same process. The International Agency for Research on Cancer classifies acrylamide as a probable human carcinogen, and animal studies have demonstrated its capacity to cause DNA damage in multiple tissue types, including pancreatic tissue. Here is what makes the reheating scenario specifically more concerning than fresh cooking. When a cooked potato is refrigerated, its surface dries out and its surface chemistry changes. Sugars and free amino acids, the precursors to acrylamide, concentrate at that dry surface during storage. When you apply high heat a second time to that surface concentrated precursor environment, the conditions for acrylamide formation are chemically more favorable than they were during the original cooking. The evidence suggests that reheated potatoes, particularly those recrisped at high heat or refried in oil, may carry meaningfully higher acrylamide loads than the same potato freshly cooked. That is the first attack on your pancreas: direct carcinogenic chemical exposure at an elevated dose. The second attack is more subtle and operates over a longer timeline, but in some ways it concerns me more because of how slowly and silently it accumulates. When cooked potatoes are fully cooled in the refrigerator, a portion of their regular digestible starch undergoes a structural transformation into what is called resistant starch. This is genuinely beneficial. Resistant starch is not digested by your small intestine in the same rapid way that regular starch is. It slows glucose absorption, moderates the blood sugar response, feeds beneficial bacteria in your colon, and reduces the metabolic burden on your pancreatic beta cells, the cells responsible for producing insulin. A fully cooled cooked potato is metabolically a meaningfully different food than the same potato eaten hot immediately after cooking. The moment you reheat that potato at high heat, the resistant starch converts back into rapidly digestible regular starch. The beneficial structural transformation that occurred during cooling is reversed, typically within the first 60 to 90 seconds of high heat reheating. What was a moderate glycemic food is now again a high glycemic one. And the organ that responds to a rapid blood sugar spike is the pancreas, specifically those beta cells, which are required to produce a large urgent pulse of insulin in response. One such event is entirely within normal physiological parameters. That is what the pancreas is designed to do. But 3 times a week, every week for months and years, repeated forced high-magnitude insulin production events drive beta cell fatigue. Beta cells are not easily replaced. Progressive beta cell exhaustion and loss of function is a well-documented pathway that contributes to the metabolic conditions that precede and accompany pancreatic dysfunction, including the chronic conditions most consistently associated with elevated pancreatic cancer risk. 2 simultaneous attacks from a single bowl of reheated potatoes. And if you reheat those potatoes in oil, you compound both of these effects with the aldehyde toxicity we covered in food number 1, maximum acrylamide formation, maximum oil oxidation byproducts, maximum glycemic disruption. Every hazard from this entire discussion concentrated into one dish. The solution: eat cooked potatoes cold whenever you can manage it. Cold potato salad with olive oil, vinegar, and herbs is not just tolerable, it is genuinely good. You retain all the resistant starch benefit, generate no additional acrylamide, and present your pancreatic beta cells with a food that does not demand an emergency insulin response. If you need them warm, the lowest effective heat level, just enough to take the chill off rather than to fully reheat to high temperature, is far better than high heat recrisping. And never refry a cooked potato in oil. That specific combination of events stacks every risk factor discussed in this video into a single meal. Now I want to address something directly before we close, because I know that for some of you, hearing this list has created a feeling somewhere between discomfort and genuine alarm, especially if you recognize several of these habits as things you have been doing consistently for a long time. I want to give you an honest perspective on that. The human body is not a passive recipient of damage. It is an extraordinarily active repair and recovery system. The conditions we have discussed today are not caused by single exposures or even by a few months of a particular habit. They develop over years of consistent, repeated patterns. That means 2 important things simultaneously. First, years of these habits do not translate into irreversible damage that is already done and cannot be undone. Chronic inflammation is a dynamic state, not a permanent one. It responds to changes in input. When you reduce the inflammatory drivers, inflammation levels come down. Cellular damage is repaired constantly as cells are replaced across nearly every tissue type in the body. The systems we have been discussing are not broken beyond recovery in the vast majority of cases. Second, the best time to change these habits is today. Not because the damage from yesterday is suddenly erased, but because every choice you make from this point forward either continues adding to what has accumulated or begins shifting the balance in the other direction. The body does not wait for a clean slate before it begins responding to better inputs. It responds immediately. What I want you to carry out of this video is not anxiety about what you may have been doing wrong. It is the clarity that comes from understanding specifically what to do differently. When you open your refrigerator tonight, remember these 5 specific changes. Fried food gets reheated in a dry oven or air fryer, never in oil, and the original cooking oil does not get reused. Cooked leafy greens get eaten cold or cooked fresh in the quantity you're eating right now, not in large batches for the week ahead. Rice gets cooled rapidly, refrigerated within the hour, eaten within 24 hours, and fully heated to steaming before serving. Chicken gets reheated in an oven with foil or eaten cold rather than microwaved whole. And potatoes get eaten cold when possible or warmed gently at low heat rather than re-crisped at high temperature and never refried in oil. These are not radical changes. They do not require you to change what you eat, only how you handle what you have already cooked. The difference in practice is small. The difference in biological effect over months and years is not. Before you go, I want to ask you to do 2 things. First, if any part of this video gave you something genuinely useful that you are going to carry into your kitchen, leave a comment below telling me which of these 5 foods surprised you the most. Your comment helps this information reach more people who need it, and it genuinely helps me understand which topics matter most to the people watching this channel. Tell me which food changed your understanding the most today. Second, if you are not yet subscribed to this channel, please do that right now. Every video we publish here is built around the kind of specific, research-grounded health information that most people never receive because it falls through the gaps between academic journals and general public health messaging. Subscribing takes 3 seconds, and it ensures that the next time we publish something that could genuinely matter for your health or the health of someone you care about, you will actually see it. Take a moment right now and think of one person in your life, a parent, a partner, a close friend, someone you know who reheats rice or leftovers regularly and has never heard any of this. Send them this video, not because it will alarm them, but because information like this is most useful when it reaches someone before they need it rather than after. The pancreas has been working for you every day of your life without complaint, without recognition, without any of the visibility that the heart or lungs receive. It has never asked you for anything. What we discussed today is a small, practical way to begin giving something back to an organ that has given you everything without your ever being aware of it. Take care of yourselves. I will see you in the next one.